Erica and I knew the value of clinical perspectives from our corporate careers. We had the privilege of working with talented nurses and pharmacists who brought that perspective to our work. As Matchstick started to grow, we felt strongly about embedding that capability here. We started to think about building our own approach to clinical insights here at Matchstick.
I started with Marty and Erica when they were still in their home office, and while I was starting a PharmD and Master's in Health Informatics program. Well, I came in and I knew I wanted to pursue pharmacy, but in a non-traditional way. And I liked where this was going. I had a bit of a background in clinical trials and in publications, so the idea of helping hundreds of thousands of patients really appealed to me. So I started doing research projects and contributing to client work. Since then, I've worked on dozens of projects and presented and published our work. So over 4 years, I showed that I could take on more responsibility and teach the team. So I was promoted to lead clinical analyst and then leader of the clinical organization.
I did my APPE rotation here at Matchstick while earning my PharmD. During my 10-week rotation program, I was able to help out one of our clients develop an empathy workshop for caregivers and patients in the disease state of Alzheimer's disease. I started with scientific research and I built a workshop around activities, posters, and videos. Then I helped facilitate the workshop at our client's site. Before I graduated, my experience at Matchstick helped me to attain an industrial job at Johnson & Johnson without a fellowship. Not only did I use my scientific knowledge, I was encouraged to use my creative interests that helped me grow as an individual.
I worked part-time at Matchstick while I was pursuing my PharmD and Masters of Health Science. I also worked at independent pharmacy. I brought dispensing and patient counseling experience to Matchstick. Social media and patient message boards are an important way patients and caregivers communicate, especially when it's for chronic diseases. While this isn't peer-reviewed, you get to see the reality of what patients need to deal with. That gives you insight into the solutions and support that they need. My work brings empathy by bringing the patient's story to life. I've helped Matchstick build knowledge and data around chronic diseases. That helps us run better studies and invent better solutions. I'm now pursuing a fellowship, and Matchstick was one of my main talking points during my interviews.
I'm a P4 PharmD student pursuing a concurrent Master's in Health Informatics. Matchstick introduced me to user research. I get to use my clinical knowledge in a different way to help educate my team and our clients to understand what it's like to be a patient with chronic disease. I enjoyed coaching and mentoring the team, and Marty and Erica saw that in me, and they allowed me to take on a leadership role to help guide the team. After graduation, I plan on doing a PGY1 residency program, specifically in ambulatory care. My experience at Matchstick really helped me be able to communicate with patients and understand their needs. The experience at Matchstick is unique. It's not a typical clinical job or APPE rotation. Matchstick is an opportunity to see drug development from the inside. You'll actually have a hand in shaping how patients receive their medication.
So as pharmacists, we see the impact of poor device design on a regular basis. And here at Matchstick, we have the opportunity to ensure that they're better.